Hi, I'm Dr. Eric Bayer with Reddy-Care Physical Therapy. I'd like to talk about knee pain. In regards to the knee, it's very important to realize that even though the pain you're experiencing is at the knee region, oftentimes the cause of those symptoms is due to weaknesses in other areas of the body. For example, if a patient has weakness in the hip and or ankle region, this will alter your mechanics while you're performing daily activities. When this happens, it will place an excessive stress on the structures that surround the knee area. Some examples of these structures are the IT or iliotibial band, which runs from the outer hip down the outer thigh to the outer part of your knee, the quadriceps, which starts at the front aspect of the pelvis, runs down the front thigh and attaches to the front of your knee, and the hamstrings, which are the muscles in the back of your thigh, attaching to the back of your knee, and the inner hamstring, which also actually wraps around from the back to attach to the inner front aspect of the knee. When there's weaknesses in either the hip and or ankle, any one of these structures can be forced to overwork, mainly because the knee is actually caught between the hip and the ankle. It has nowhere to go. In regards to structural abnormalities at the knee, two very common diagnoses are arthritis and tears of the meniscus. It's important to know that studies have recently shown that even if these structural abnormalities do exist, there is oftentimes not a direct correlation between them and pain. This means that even if you do have arthritis, even if you do have a tear of the meniscus, it's not a guarantee that that is the cause of your symptoms. In some cases, it can be. In a much higher percentage, we've found that muscle weaknesses and muscle imbalances is the primary cause of the symptoms. When it comes to performing an assessment for your knee pain, we as therapists have several tools that we can use. These include range of motion or flexibility testing, strength testing, functional testing, which would include observing you walk and observing you perform whatever activity it is that would typically reproduce your symptoms. The most important aspect of our assessment is to establish the cause of symptoms rather than simply treat the symptom. What that means is that simply treating the pain at the knee will oftentimes not result in positive outcomes, or in some cases, give the patient short-term relief. In order to completely resolve the patient's symptoms, it's vital that we establish the cause of the symptoms at the knee, which, as mentioned earlier, is usually due to weaknesses in other areas of the body. Once we establish the cause of the patient's symptoms, then we can establish an individualized treatment program for each patient. For example, just to reiterate how important this is, 3 patients could come to the clinic with pain in the exact same location of the knee. Let's take, for example, the front of the knee. Those 3 patients, even though their symptoms are in the same region, could have 3 different causes of that symptom. That would mean that those 3 patients would have 3 individualized, different treatment programs. If you have any questions, or if your family or friends have any questions, feel free to contact us. We'd love to help. Thank you for watching.